PACE has unique advantages over other healthcare plans. One advantage is that PACE takes a broad view of health that includes social health. And I want to dive into this as an idea and a concept and what it means for marketing and enrollment. And I also want to talk about the delicate balance between talking about PACE as exceptional healthcare for older adults or leading with it's a day center. And I'm inspired by this book by Kasley Killam. It's called The Art and Science of Connection. PACE is exceptional healthcare, and part of that healthcare is social health. So PACE creates a community space with engaging activities, personalized care, and social interaction. None of this is new to you. PACE is much more than a day center. And while the day center is a valuable part of PACE, it is not the core of what makes PACE unique. All right, leading with the day center can kind of give the impression that we're a social program, and it can diminish the exceptional healthcare that we provide in PACE. So when discussing PACE, I always want to elevate that healthcare should always lead. Healthcare should always come first. In PACE, recreational therapists are part of the care team, and they are typically designing activities to serve participants in 4 key domains: cognition, physical, emotional, and sensory. All right, so the recreational therapist is key to creating this social health aspect. You should have testimonials from your participants that echo these benefits. Quote, "I feel like I have a new family here. I don't feel lonely anymore." Or, quote, "The activities keep me busy, but it's the people who make me want to come back every day." So in your marketing, which I'll refer to as like awareness building activities, you can highlight stories of friendship. You can show group gatherings. You can show visuals or tell stories about the family-like atmosphere. Also, you can promote emotional support and talk about daily connections. Now, I always say enrollment is the start of person-centered care in PACE. And so as an enrollment professional, it would be interesting to understand the different styles of social health that most people generally fall into. So knowing that there's different styles of social health and forming connections, you can have better conversations with people. For instance, when you're asking open-ended questions, you might ask, do you like spending time with just 1 or 2 friends, or do you like bigger group activities? If you're an outreach professional, I'm always encouraging to have your stories and know your stories of your participants, but it's also good to have data. So you have ISAT data from your PACE, and you can also use broader public data. It doesn't have to be specific to PACE. For instance, seniors who stay socially active have a 50% lower risk of dementia. Loneliness raises the risk of early death by 26%. If this idea of social health in PACE is exciting to you, I encourage you to click through the link below to the blog post where you can read a little bit more about it, and you can print it out or share it with your team.